Hi, Dr. Alex Taghva, board certified neurosurgeon. Wanted to talk to you about something that's a little bit counterintuitive, which is the causes of back pain in athletes who participate in rotational sports. Sports like golf, tennis, pickleball, baseball, anything that really requires rotation. So, the first thing that is highly correlated with back pain in rotational sport athletes is lead leg hip mobility. So that basically means how well the front leg, when you're hitting or throwing something, rotates, and especially internal rotation. So, why is that? Generally, when we're trying to, let's say, hit a tennis ball or go through a golf swing, we have to start sideways, and then at the finish of our stroke or shot, we have to be facing towards where the ball is going. And that requires essentially a 90-degree rotation. If our hips move well, most of that rotation happens at the hip. Unfortunately, if our hips don't move well, our back has to take over. And our back, given that there are a number of mobile parts and vertebrae, has more degrees of freedom. So it's able to take over that rotation. The problem is our discs and our facet joints aren't really made for that. So what happens is when we use our hips incorrectly and we use our back to take over, we put torsional strain on the disc. Second thing that is highly correlated with back pain in golfers especially is short hip flexor length. If your hip flexors are short, it rotates your pelvis downward, something we call anterior tilt. The problem is when you have an anterior tilt of your pelvis, it creates a translational shear. So gravity is pulling down on the front of your spine. And when you do that, it creates a translational shear across your discs. Finally, third thing is lateral bridge asymmetry. So essentially, what this means is when you do a lateral plank, whether or not both sides are equal, if your weak side is 12.5 seconds shorter than your strong side, then you have a meaningful asymmetry that's correlated with back pain in athletes. Building that symmetry is important because, especially if you have a dominant hand, the muscles on one side start to get stronger than the other, and that can pull your spine into a scoliosis or apply lateral compression on the discs,